Hello, my name is Dustin Kelly. The mental health project that I chose is mental health among intensive care nurses, ICU nurses, CCU nurses. Mental health among healthcare professionals has been an issue of concern in contemporary times, especially due to existing nursing shortage crises. One focus on mental health of a specific population, such as ICU nurses, is the situation is concerning. It's a real situation that isn't being brought to real time, or it's constantly overlooked or under budgeted. Statistics show that 57% of these nurses have at least one mental health illness already, which manifests in the form of anxiety, depression, PTSD, and other disorders. More information shows that at least 500,000 ICU patients die per year. On top of the added stress of the job, you have a consistent rotation of death of varying ages, from infancy to elderly. Due to that environment, it also includes moral distress and burnout. Statistics reveal that CCU ICU nurses have a higher chance of experiencing mental illness when compared to the rest of the public. The patients are also likely to experience incident mental health disorders. The ICU exposes nurses to a specific environment that is likely to affect their mental health. There's a picture here of some people in the hallway. Nurses, healthcare providers, stressed, tired, and exhausted. The teaching educational program targets ICU, CCU nurses, who are referred to as critical care nurses in some places. In the country, there are more than 63,000 CCU RNs. However, this number could go down because a study found that 42.9% of these nurses consider leaving their jobs. I know from personal experience there's been numerous healthcare providers who have went to school, been in nursing for 5, 6, 7 years, and has decided just to quit altogether. Now they're doing something completely unrelated to healthcare, and honestly, most of them are doing something completely unrelated to dealing with the general public. Compounding on top of this, the pandemic increased that number to 66%, according to the AACN. And then among that population, 75% experience some type of stress, frustration, or just plain exhaustion at some point in their work. All of these aspects are contributory factors to mental health issues. That's just talking about issues at work that cause stress. That doesn't add into the fact that there's personal stressors at home. Someone could be going through a divorce, had a family member themselves die and pass away. And then on top of the workload stress, just adds and adds and adds. Therefore, there is a need to pay attention to mental health needs, state and awareness among critical care nurses. The average education level for CCRN is typically a bachelor's degree, but some have associate's degrees. Therefore, the targeted learners are able to comprehend a higher level of content of this topic, and which comes with that, it needs to be geared towards them in a way that isn't also exhausting to have to listen to. More respectable of their education and knowledge level, so it should definitely be at a college level of instruction. The teaching philosophy. This program will be based on adult learning theory, which is also known as androgyny by Malcolm Knowles. Knowles started by creating 4 assumptions in 1980, and then he added a 5th one in 1984. The first assumption relates to self-concept, which poses that a person grows in age, their self-concept changes from that of dependence to a self-directed individual. It is about understanding or knowing why the knowledge is important. The second assumption relates to the learner's experience. As an individual grows, they increase their experience, and then that becomes a crucial learning process. We all learn from making good or bad decisions, right or wrong decisions. Therefore, an individual is expected to learn exponentially. An additional assumption is readiness to learn, which indicates that as a person grows, their readiness to learn is linked to the developmental task of that social role. Therefore, they see learning as a problem-solving initiative. The fourth assumption is orientation to learning. As an individual matures, their time perspective shifts from one of postponed knowledge application to an immediacy of application. As an outcome, their orientation toward learning becomes problem-centered as opposed to subject-centered. The last one is their motivation to learn. Knowles has a statement that motivation to learn is internal. The theory to help the educator to consider different aspects of the nurse's learning needs and create a strategy to address that. The teaching objectives. The objectives are meant to help nurses move from a generalized perception of mental health care to a personalized one. Not everyone has the same stress. Not everyone has the same issues, and they all can't be addressed. There's no a blanket policy for everything. The objectives will not only help them to understand the causes, signs, symptoms of mental health issues among their peers in the ICU, but it will also allow them to create mental health care plans that can help them actualize mental well-being at a personal level. So giving them the resources to be able to create their own plan to adjust it to their own issues or own level of personal care. They will also identify ways they can avoid, mitigate, and manage mental health issues through coping mechanisms. I know coping mechanisms is a big one. Coping mechanisms can turn into dependency issues. It can get out of control, and lead to diversion issues at some point. But this aspect will not only elevate them as individuals, but knowledge will empower them to help their peers and coworkers as well. The type of teaching materials. We use different materials to appeal to various learning styles for the targeted audience. A PowerPoint presentation. It'll cater to the visual aspect of learning. We'll also include videos, mainly from YouTube, newer videos. We don't want to watch stuff from the 70s. It's staticky and doesn't keep attention span these days. And then those videos will also obtain more information about a topic, or maybe even a specific topic in detail. And that'll cater to the visual learner as well. We'll put up posters, common areas, break rooms, bathrooms, drug rooms, miscellaneous areas. Time clock is a good one because people stand around the time clock for 30 minutes at a time, sometimes when they clock in or out, waiting to clock in or out. We'll create brochures and pamphlets, which will be handed over to everyone that they can use, provide them some notes on it. And they can read those during their free time, or even provide those to someone who wasn't able to attend the lesson. We'll also take advantage of digital resources such as social media platforms. There's lots of ways, an unlimited number of ways for digital resources. Community platforms that focus on CCRNs, Facebook pages, support groups, those tips and tricks pages are good ones. That's a summary of the lesson that will be offered to help people gain the most relevant information about the topic. We'll also can use some whiteboards and flip charts. case studies, real world stress scenarios, partnering those with some videos, um, templates for a self-care plan, so providing examples that they can go by, markers, pens, sticky notes. We'll need laptops, projectors, and then at the end we'll do a feedback, evaluation, and a quiz. The quiz doesn't necessarily need to be a like a test, but more. I'd like to make it more of an interactive activity. I know one of the big popular things right now that we use a lot is the website where everyone gets on their phone and can send stuff up to the screen, and everyone can see their responses or see a percentage or a score. Those are really popular and effective, especially today being a very big digital world, and it provides interaction too. Some YouTube videos, some common factors that cause nurse mental health issues: trauma, compassion fatigue, workplace bullying, lack of support from nurses and managers. That's a big one too, is if you feel like you're at your job and you don't have anyone to help you or support you, you start getting down, start getting burned out, getting tired of what you're doing. Having a good work-life balance, and then just physical exhaustion. Lesson plan objectives, they're based on knowledge, skill, and application. Each objective caters to 3 components. By the end of the lesson, the audience will be able to identify mental health challenges, describe stress reduction strategies, and create a personal mental health plan themselves, or help someone create one. They will be able to develop a care plan that will not only help them once they finish the lesson, but will be beneficial in the future as well. Keeping up with your health plans, going back and look at them over time, seeing how you've improved, what things haven't improved, what you need to work on. And that'll help, all this will help give them the knowledge and skills needed to make adjustments and make it more personalized. The teaching methods. The visuals will be needed to communicate relevant information, such as our main topic, the mental health challenges. We'll need to use different platforms to achieve this. Digital resources, social media, print, hit all the types of learning areas that we can. But we'll also need to be able to accept feedback ourselves. So every class, get feedback, use that information to try to improve it better for the next class. Also need to be prepared to answer questions that are off topic or address any issues or concerns raised by the nurses. There's always some question or topic that's going to be brought up, and you need to be prepared to be able to answer those type of questions that come up. And then we'll also need to consider the professional nature of the nurses, since they are busy. This is cutting into time that they have. It could be a day off, it could be a break. So we'll need to be respectful of their time and presence. Various channels and resources will be used to ensure that the lesson is customized to meet these needs. We may need to do pre-recorded PowerPoint presentations, record some lessons for those that's not available to make it, or the time frames don't align up with when they work exactly. But we'll need to keep those in mind and be respectful of them as well. That's my lesson plan and PowerPoint presentation for concerns. Mental health is a personal topic one for me. So here's my references page. Thanks for listening.